My name is Alia Bosworth. I am a patient of Dr. Kalus's. This past May 2024, I was diagnosed with breast cancer. And I'm very grateful that it was stage 1 and that I could have surgery this summer. I did a reconstructive surgery. In the same surgery as the removal of the breast cancer, and Dr. Kalus did my breast reconstruction. I have to say, I interviewed lots of doctors, as I think anyone would who's going through this process, before I chose Dr. Kalus, and he was by far and away the one who made me just feel so comfortable about what was going to happen throughout the surgery, what the results were going to be. And what I really appreciated was his honesty. You know, a lot of doctors will either not tell you anything because they don't want to guarantee or promise anything, or they'll give you the best case scenario, but not really help you understand what recovery could look like, what the surgery actually could look like. You know, Dr. Kalus was really honest with me that he was going to do his best to understand what I wanted from the reconstruction, but he was going to make the final call in the surgery because my health was the first priority to him. And he was really the only doctor that said that. And that really stuck with me. And it was one of the main reasons. I remember my husband and I going home, and my husband, before I could even say it to him, said, "You know what I loved about him? I loved that he wasn't willing to take any risks to make something what you wanted it to be. He was going to take the reins and make a medical decision." The surgery was really long. My surgery was really long because I did have removal and reconstruction in the same surgery. So Dr. Kalus said to me, very point blank, "You may wake up and have no reconstruction. And that's going to be because I need to make sure that you are still in good condition after the removal for me to continue on, because the surgery is very long." And, you know, he said, "I don't want you to be disappointed if that happens. We will go back in a couple weeks, but your safety is my first priority." And that meant a lot to me. And I was very grateful that that did not happen. I woke up and I had the reconstruction. He was able to do it. But I just loved the way that he really thought about communicating to patients. A lot of times with doctors, you don't get that level of communication. You have unanswered questions. He went into the detail about every bit of the surgery, probably more detail than I wanted to know. But he wanted me to really be sure that I understood everything he was going to do, all the decisions he was going to have to make, and the decisions we would make together after the surgery. The follow-up has been incredible. He gave me his personal cell phone number after my surgery when I was at home recovering. And I did actually text him once because I wasn't sure about the drains and what was happening. And he texted me back within minutes. He's really, really been there for every question I've had. I've been to 2 follow-ups. He is there personally. A lot of times you're following up with a nurse or someone else that is not the doctor after you meet with them, but he really has spent so much time answering every question I've had, answering questions my husband had, and just spending the time to show that he really cares about his patients. I absolutely love working with Dr. Kalus. This past summer, I was diagnosed with breast cancer. It's results that nobody ever wants to get, especially as someone in their 40s with a 3-year-old. I just never thought it could happen to me. And I was so grateful to find somebody as educated, smart, kind, and caring as Dr. Kalus to do my reconstructive breast surgery. It really started with me interviewing lots of doctors, but when it came down to it, nobody was as passionate about making sure that what I wanted to happen at the end of the surgery could happen for me. Nobody was as honest about all the steps of the surgery and all of the recovery. And nobody was as caring. followed up with me by phone during my recovery multiple times. I had his personal cell phone number, his nurses, his staff, everybody you could tell loves working for him. And I look at that too. Often you see how much somebody is really respected by the people around them. And his nurses have been with him for many years. His whole staff is just a genuine team. And I would recommend Dr. Kalus to anyone. The first time I met with Dr. Kalus, he did an evaluation of my current breasts, knowing that I was doing a double mastectomy and he was going to do full reconstructive surgery. Obviously, I had a lot of questions. I wanted to really understand what the end result would look like. And a lot of other doctors that I talked to were very medical about this. Okay, you're going to have a double mastectomy. I'm going to put you back together. And what was refreshing about Dr. Kalus is he really asked me, what do you want to look like after this? We're going to do this. So if you had a dream, if you could have your dream boobs, what would they look like? And it's a funny thing to think about when you're going through breast cancer, but I loved that he cared about the rest of my life after that. And that was really important to me, and it really sets him apart. I don't have a lot of friends that have had reconstructive surgery, but I have a lot of friends that have had breast augmentations. And most people cannot believe that the reconstructive surgery that Dr. Kalus did was not a breast augmentation. Because I will tell you, they're better than they were before, and I'm grateful for that, because that was not any outcome that I ever could imagine happening going through breast cancer. But I constantly have people making comments about how great my chest looks, and they literally cannot believe that it is not an augmentation, because there's very little scarring, and it looks and it feels good, and it's also suited to my body. I think that's really important. Is Dr. Kalus made the decision. He knew what I wanted. I showed him pictures, but he made the decision on a size that was going to work with my body versus me asking him for something and him giving it to me if he didn't think that it would work for me. If I could describe my results from my reconstructive surgery that Dr. Kalus did in 3 words, I would probably say extremely professional, overjoyed, that's more my emotion, and positive. I think anytime you have surgery, there's always fear of complications, fear of it not looking the way that you thought it was going to look. In my situation, I was having breast reconstruction after a double mastectomy. I had never ever had a surgery in my life before. So I was worried just about surgery in general. And then there's also the fear of when you get a double mastectomy of just never looking like a woman again, never looking like yourself again. And Dr. Kalus really took the time. I think he spent an hour with me the first time we met, sitting face to face, telling me about what it was going to be like and comforting me. He showed me all different size implants. He talked about the process of implants mixed with cadaver tissue. He showed me results photos of other women. And he talked to me about if that didn't happen, what we were going to do after that to make it the way that I wanted it to be. When I was first diagnosed with breast cancer, the first thought in my mind was that I was just never going to look the same again. And I'm so, so grateful for Dr. Kalus, because not only did he do a reconstructive surgery for me, but he found a way to make my boobs look even better than they looked before. And I'm not somebody that had a large chest. I have breastfed a baby. So I am overjoyed with the result. And it really fits my body. It doesn't look out of place. I mean, most people don't even know that I had breast cancer. And I feel really confident every single day with the surgery. Dr. Kalus was the fourth doctor that I met with when I was trying to choose a doctor to do my reconstructive surgery. And I have to say, the first three were all very similar. It was, I'm going to put you back together after you're taken apart. And it was a little cold and a little medical. And when I sat with Dr. Kalus, he didn't even get right into it. Most doctors are like, okay, take off your shirt. I have to measure. I have to look. And he was like, tell me how you're feeling. I heard that you were just diagnosed with breast cancer. Like, how are you doing? And it was that personal connection, that emotion, that really drew me in. And I have to say, my ears perked up. It just felt so nice to have somebody ask you that when you're going through that. And it just started our journey. I knew that he was the right doctor.